Hi, this is Polly. And I have autism. High Functioning Autism. Which is just a name, really. It's an inadequate name. High Functioning. What it means is, I seem normal and I'm able to function better than people who are worse off, who have a more severe form of autism. But I am not a high-functioning individual. I'm on disability. I'm dependent. I can't find help anywhere. I'm bullied by a whole lot of people that think that they are better than I am. They see me as different, and they haven't matured a single freaking day since high school, and I mean, some of them are in their 50s and 60s, and they treat me like crap. And it hurts. It really hurts. Well, the reason I'm making this video is I want to show you something about autism that many people don't know, many people don't realize. And I don't know if it's true for all autistics or all autists at some level or not. But I know it's true for me. I know it's true for some autists. There are things that trigger our autistic behaviors. Like right now, I probably seem like a fairly normal person to you. You wouldn't look at me and think, well, there's somebody who has a developmental disability. Probably, you wouldn't think that. I seem very normal. My speech patterns are probably, reasonably typical. I'm able to make some facial expressions. I look like a gopher. Broke my tooth. Both, actually, of them, on a freaking granola bar. But, anyway, as normal as I seem, sometimes when my autistic traits are triggered, I'm a totally different person. I have meltdowns, just like the most severe autistic people. I cannot function socially in society without being ostracized, shunned and ostracized even by my own family. I grew up in a family of 4. I was the youngest. My mom, my dad, and then my brother, who was 7 years older than me and built like a tank. And basically, it was all about survival, just trying to survive. It was a very angry family. My parents did not understand that I had a neurological or developmental disorder. They just thought I was a bad kid. They just thought I was a disobedient child who needed to be punished. To this day, I have nobody in my corner. I have nobody helping me. Well, save one doctor who knows that there are issues, gives me pep talks. He doesn't even charge me because he doesn't take Medicaid. But he has a lot of compassion for me because he's seen how much I've struggled. He's a good man. So he gives me pep talks, but otherwise, I mean, there's nobody. There's no agency to help me. And I'm not the only one. I'm not the only one. There are other people just like me. In fact, there's another one on YouTube, different presentation of autism. Her name is Melissa Fields. She has more of a consistent flat affect, kind of stone face, which presents problems for her, terrible problems, because people don't realize that that's her with a developmental disability. They see that as her personality and as her behavior, and they treat her like crap. Well, what I wanted to show you, I think will pretty much astound you, because this persona that you see here, this very normal, for the most part normal looking person, is not normal all the time. I become very childlike, very incapable, and very oddly behaved, however you say that, when my autism is triggered. Whenever my brain does not work the same way as the brains of a neurotypical, normal, functioning person. I'm smart. Most autists are very smart, very intelligent, above average intellect. We just think differently, and if we had our own world, if we were the norm instead of the exception, basically, we'd be fine. We would be fine. It'd be the rest of the world that would be struggling, but as it is, we cannot abide by the social rules that have been set forth. We're not acceptable because we don't have the same wiring. We cannot behave socially in the same way that normal people can, and that normal people expect other people to behave. And so we're cast out, we're shunned, we're misfits, we are worse. I mean, people think they use that as a reason, as a rationale to abuse us, to treat us like crap. Our lives, for many of us, our lives are absolutely and utterly miserable. Okay, so I'm going to show you some footage that was taken a few months ago. My hair was longer then, but I found it. I had never uploaded it, and it was taken during a period of time where you can very clearly see my autism. You can very clearly see an entirely different persona, different presentation of me. And hopefully you'll understand a little better about high functioning autism and how a person can manifest as normal, as I am right now, some of the time, and yet not be able to maintain that. I mean, partly what I'm doing right now is acting. I mean, it's not hard right now, so maybe right now it isn't acting. But there are times, especially when I'm around other people. What I'm doing right now, this monologue where I'm recording myself, this is easy. This is easy. Engaging in conversation with people, not easy. Then I'm acting. I have to consciously tell myself, alright, I probably should look away now and not bore my eyes right into theirs, because that's going to wig them out. You know, I've probably looked at them long enough. I need to avert my eyes. I have to think that. Other people just do it, but I have to think that. I have to try and figure out how long to look at somebody when I'm talking with them, and then you know, where do I look? You know, it's very awkward because I don't know exactly where to, you know, set my gaze. And then again, you know, and then when to look back. And the thing about me is a lot of people are uncomfortable around me because I don't know how to behave socially. I don't mean that, you know, I don't mean that I'm, for the most part, immature or, you know, ridiculous, but just obviously not normal. Those social rules that people just get, they're, you know, I don't get them. I don't understand them. I don't get them. So, you've gotten a good idea of what I'm like now. In my normal state, seem like a normal human being. Now you're going to see what I look like when I am in a full-blown autistic state. Here goes. Okay, so that's pretty much what I'm like when my autism is triggered. I mean, it's always there, but when something triggers me, and I mean, you can see a drastic difference there. Drastic. And that's the way it is. And in fact, actually, if you go back and you look at some of my past videos, you will see I purposely didn't put up anything that severe before. And there wouldn't have been a reason to, basically, because I wouldn't have had anything, I wouldn't have been functional enough to say anything really worthwhile. In fact, what you will notice when you do see a presentation that is closer to that in my past videos, if you were to go and look at them, in some of them, you would see something that is more like that, but not as extreme. Rocking, and maybe some automatisms, or, you know, like automatic movements. A lot of head-touching things. I do a lot of head-touching things, and a lot of things where my hands come up to, like, my chest level or up to my head. One thing that's interesting is that although I know I have autism, I don't know whether I have Asperger's syndrome or whether I have just high-functioning autism. And for a long time there, those two were distinctly different, or were categorized, classified as distinctly different. And I think they're merging them now. But my understanding, and I don't know, I really don't know why they're merging them or what they've decided, but I know that with Asperger's people, the presentation of the symptoms is greatly different than mine. And case in point, I think I mentioned her earlier, Melissa Fields. You can look her up on YouTube and watch her videos, and that is a very good example of a very classic Asperger demeanor. Very rigid, stone-faced, flat affect, kind of a harsh tone, speaks like this. That's very Asperger's. I don't have that. And I'm very, very grateful that I don't have that. That'd just be one more piece of a very tragic puzzle. And she's having a miserable time in life for a lot of reasons associated with autism, but also because people misunderstand her. People think people think I'm bad. People think I'm argumentative, and I can get along with my peers, but I cannot seem to get along with anybody who considers themselves, you know, an authority in my life. And especially women. I can get along with men, but I cannot get along with women. Anyway, so it would be interesting for you to go and see how differently she and I both behave. My suspicion is that I actually am a classic high-functioning autist. Maybe classic isn't the right word, but possibly higher up the spectrum than Melissa is. Possibly, I'm not sure about that. But she has the Asperger's, the classic Asperger's appearance, behavior. I do not. Mine seems to switch back and forth, and not seems to, it does. I mean, it's like you know, it's triggered. And it takes me a while to come out of that. I should also mention that in that example that you saw me speaking, but you didn't hear me speaking. And there's a reason for that. You'll also notice that in past videos, when I first start, when I'm in that mode, and I first start to speak, I make these gestures, but I don't really know how to actually get my speech going. I don't know. It's vastly different than, say, right now, where I turn on the camera and I just start speaking. When I'm in that frame of mind, when I'm in that state, it is very difficult for me to speak. I mean, not physically, but it's just difficult for me to initiate sound somehow. And I could not do that at the time that footage you just saw was shot. I couldn't do that. So my only option was basically, as I felt, my only option was to speak without sound. Something else I also need to mention, though, is my autism is not something that I can separate out and say, if it weren't for my autism, I would be a perfectly normal person. Because I suffer also with post-traumatic stress disorder, and a lot of the teary, where I'm sobbing, you know, a lot of those videos where I'm sobbing, and I'm talking about my mother, and I'm talking about how he basically murdered my father. A lot of that is the post-traumatic stress disorder. So, that's, you know, part of my behavior too. And I'm also, what do you call it? Well, forgetful, because I can't remember what the other thing was I was going to say. Oh, absent seizures. Maybe I just had one. But anyway, yeah. I also have absent seizures. Documented, verified. And so these things kind of muddy the waters as far as what's the PTSD behavior, what's the absent seizure behavior, what's the autism behavior, and maybe you can't even distinguish them separately because they're all going on at the same time. I don't know. My life, because I had autism and because nobody understood that I had autism, and nobody understood that I had a developmental disorder, my life was very painful. I was punished constantly. I still am. I am punished by people all the time. I can't get help because people feel like I'm argumentative, and I don't realize I'm arguing. I don't know that I'm arguing, but they perceive that I'm arguing. And so they get vindictive a lot of times. Not everybody, but a lot of people don't want to help you when they think you're arguing with them. It's a control thing, I guess. And I believe the same thing has happened to Melissa Fields. And I think it's probably happened to a lot of other people with autism. If you have autism, you are severely, severely misunderstood in life. Misinterpreted, misunderstood, and treated very disrespectfully. At least, that's been my experience. I can't say that about everybody, but the likelihood would be there, and it certainly has been my situation in life. But I just wanted to I wanted to share the differences between the the two types of autism as they once were labeled. Again, I don't know how they're merging them, but I believe that they are now, thinking that high functioning autism and Asperger's are the same. If they are, then my differences are probably a matter of degree, but also when I have that autistic episode, I become like a child. So part of that may be, in fact, PTSD. I become very childlike. My pattern of speech changes in this, I believe, if I remember correctly, becomes slower. But there are numerous videos that you can, of mine, that you can, see this in as well. Like I said, not quite as extreme as that, because I was speaking in all the other ones. But very childlike. Very childlike. I don't know. I'm a pretty screwed up individual. But I wanted to share this because I really believe people need to understand that, persons like myself are not bad people. I am a very good person. I am a kind, compassionate, open-minded, loving person who cares deeply about people, even people I don't know. And I think the very nature of autistic people is that, although I think it swings to one degree or the other, because some of them are said to be without empathy. I have, major amounts of empathy. Too much empathy. Too much empathy for my own good, because I just suffer a lot with it. So anyway, hopefully I didn't confuse you too much. But check out Melissa Fields. This lady is suffering tremendously as well, and even more bullied than I am. Unfortunately, her neighbors are bullying her. Her demeanor causes them to think that she's just a bitchy old hag, It's not the case. It's the disability, but you'll understand when you watch her videos. And you'll also see the tremendous pain that she's in. And you'll also see that demeanor that I'm talking about, that very stoic, very hard-faced, flat affect demeanor, which contrasts greatly from my own. Okay, so I hope you found this informative, and just keep in mind all the people out there like myself and like Melissa Fields, all of those people who are autistic adults, because we basically are on our own. We're on our own, unless our parents are helping, and hers and mine are not. We are on our own, and we are not all that functional. It's like throwing children out onto the street in a sense. So, I guess that's it. And thank you for watching.